So good afternoon again, everyone. So in this session, we're going to be, as I was saying, discussing outcome successes and lessons learned from the implementation of emergency SARS-CoV-2 external quality assurance program. And this was necessitated, as you know, with the outbreak of the emergence of SARS-CoV-2 and the subsequent pandemic that we are all still living through. There was an escalation in the number of tests that were being done globally and also regionally across our own continent. And we had to look at the quality of testing related to SARS-CoV-2, what is going on, and to ensure that we were having accurate, reliable results that were being used in decision-making so that we didn't see an escalation of infections across communities. And so through the efforts of ASLM and Africa CDC and our partners, we were able to implement an external quality assurance program for SARS-CoV-2 across a selected number of countries across the continent. And this afternoon, we want to present the results, the lessons learned from that. We're going to have 3 presentations. The first is going to be by Dr. Marguerite Massinga, who is going to look at overall the implementation of the program, how we went about the implementation of the EQA program. Then we're going to hear from One World Accuracy, who is going to give, and Dr. Jean-Frédéric Flandin, who are going to give a presentation on the specifics that went into the preparation, the distribution of the panels, reporting, and the results that we saw. And then we're going to have a final presentation from Dr. Amina Bint Yunus, who is going to look at Cameroon's experience in the implementation of the SARS-CoV-2 EQA program. So just before we start those presentations, we just have a few housekeeping announcements. Please, as the presentations are ongoing, if you have any comments, put them in the chat. After the presentations, we will address them, any comments or any questions. Also, there are translation services from English to French, so please click on the appropriate channel and you will be able to access those translation services. So without further ado, I would like to ask Dr. Massinga to share her screen and start her presentation. Thank you.
Good afternoon, good morning, or good evening, everyone. I will be giving you a quick review of the program that was implemented in Africa to support the scale of quality assurance tests on the continent. So as we all know now, testing is really the cornerstone of the global strategy to contain the pandemic. So it's the first stage of the test, trace, treat or isolate to be able really to contain a transmission in the countries. And so soon at the beginning of the pandemic, African countries came together and they elaborated a continental response plan. And as part of this continental response plan, there was a task force which was put in place under the lead of Africa CDC, and that's the African Task Force for Coronavirus, or the AFCOR. And this task force was really looking at the main area of interest to sustain the response against COVID-19. And one of them was about laboratory diagnostics. And there was a special initiative which was called the PAT initiative to really scale up testing, tracing, and treating of cases. And under that initiative, Africa CDC came together with WHO Afro and the West African Society of Health at WAHO. And we were able, as a continent, to really scale up a diagnostic capability from no lab in January 2020, because the virus was just yet discovered, to the 2 influenza reference labs that were NICD in South Africa and also Institut Pasteur in Dakar. And from really those 2 labs in the scope of really few months, the whole continent was equipped with at least 1 laboratory, which was in position to make the diagnostic for COVID-19. And so more than 1,000 lab personnel were trained, 5 million tests were purchased and supplied through a approved procurement mechanism. And this enabled the continent to really be able to conduct more than 15 million tests in 2020. And so as part of the scale-up, it became really key. It was really a main consideration from the beginning that we had to ensure that, because this was a new method for testing, it was a new virus that had just been identified, and it was quite a complex diagnostic procedure, RT-PCR, which was being deployed. So special attention had to be paid really to ensuring the quality of the test results which were being released. And as part of ensuring quality of testing, external quality assessment really came to the forefront, because that's a mean to really being able to evaluate testing competency, to have an oversight of laboratory performance and the reality of reliability, of the testing method, and ensure accuracy of the results reported. And how can external quality assessment be implemented? There are different ways. We are most familiar with proficiency testing, which is oftentimes equated with international EQA programs, but you can also have retesting and also on-site evaluation. But at the end of the day, you aim to really be able to produce reliable data, which would enable the country to monitor virus transmission in the population, and also to guide evidence-based intervention for pandemic response at the country level, but also at the continental level. So the effort to scale up the EQA in Africa was done under the umbrella of two projects, one of which was the Resolve Search COVID-19 testing project, and the other one was a Step Up COVID-19 project. So these are two projects which are spearheaded by the Africa CDC, the African Union, and/or ASLM, and it relies on the model of engagement of the country to really drive their willingness to participate and to really have a strong engagement. And so a note verbal from the African Union was first sent to the country, to the Central Laboratory Coordination Unit. So it could be the National Public Health Lab, but it could also be the COVID-19 response entity, which have been put in place. Some of them at a very high level. It can be the presidency, it can be the Prime Minister's office, or it can be the Ministry of Health. And so we also made sure to have in place an in-country coordinator, which would really coordinate at the country level with that central laboratory coordination entity, and working with the National Technical Working Group, or the lab pillar for COVID-19 testing. A rapid situational analysis was performed, a country-specific work plan corresponding to the priorities as identified by the countries was elaborated, and we made sure to also ensure a synergy with other stakeholders. And we also synergized the funding. So part of the funding to drive EQA came from Resolve to Save Life. There was also funding from UNITAID and funding from the CDC Foundation. And the first stage was really to develop the guidance and ensure that it was widely disseminated. And so there was guidance from the African Union and Africa CDC. There was lab-specific guidance also through the AFCOR, some of which were led directly by ASLM. An example is quality assurance guidance for COVID-19 molecular testing. And the dissemination took place through the very session that we are having now. So the special COVID-19 echo session. So many of you have attended to prior session, and you might be aware that we covered elements of quality assurance through those sessions as well. And finally, a WhatsApp group was put in place to be able to really reach out directly to the end users and respond to the everyday questions in the routine of the operation, the lab operation, any issues arising around testing and around quality of testing and around the EQA program. And the synergy were also at the level of public health agencies on the continent, because WHO quickly set up also a WHO ECAP, so the EQA program, which was more tailored towards the reference lab, like I said, the influenza network of laboratories, so at the higher level. And so we aim to really complement those efforts. And so the ASLM ECAP was designed to really enabled the expansion of the WHO ECAP to reach to the lower tiers of the lab network and also associate the private sector, etc., as per the country priorities. And so the idea was really to ensure quality of testing throughout the healthcare pyramid, that whole level where testing was being extended. Specific areas were identified to provide the support. The first of all had to do with the selection of the EQA provider. And so we use different approach. For example, for the Southern African region, TISL was the one identified for providing the EQA services, whereas as you saw, we were covering also the central and the western region of Africa, and we had a need to have also an EQA provider who could manage also with French end users. And so One Health Accuracy was also selected on the basis of their flexibility across languages. And then the second stage was to ensure coordination among all actors, and specifically coordinating with the EQA provider to make sure that the shipment of the PT panel would take place through the defined national coordination unit. We also provided support for the reception of the PT panels and the distribution in the country. So it could be through technical support for the elaboration of guidance, but also financial support for the transportation of the PT panel as we were reaching to the lower tier of the lab network. So there was that need to really make sure that they could be brought to the testing lab in time because the window of testing was limited. There was also orientation webinars, which were organized between the EQA provider and the end users in the lab to really help them to introduce them to the interface that was being used for submission of the results. And then finally, we've also provided support for addressing non-conformities and corrective action. And this is through the means of site supervision. And so we were covering really all the essential step of the EQA cycle, meaning not only sending the PT panel, having them examine results reported, feedback on the results submitted, but also addressing non-conformities to really ensure that there was a cycle of continuous quality improvement throughout the national lab networks. And so over time, we can see that really, first of all, the number of labs in the countries that were targeted by the project increased quite rapidly. And we were also making sure to have them enroll in an international EQA program. But there is always a gap because it's not always possible to keep track of all the new labs being set up. 2 rounds of EQA were organized. The first one in September 2020 and the second one in February 2021. And One Health Accuracy will be providing the details and the outcome of those. And then finally, we also supported countries to organize national external assessment program. And so these national EQA program were based on quote unquote more simple methods than PT programs. So we could have a sample retesting, sample exchange, or national PT shields for some of the countries that already had the capacity. As we can see on the figure here, so Uganda has a very good coverage of 100% of their lab, and they are being covered by sample retesting. So in blue, you have sample retesting. So all the countries that were supported and were willing to identify this as a priority, all of them were implementing sample retesting, so opted for that need of EQA. But Ethiopia has been implementing in parallel also a national PT shield. And so the level of coverage varies across the country, also as the lab network is being extended. And finally, the last element that was really targeted by the support was that of monitoring and evaluation. And so both at the project and also at the country level, so we had dashboards which were being developed and to provide really an overview of the coverage. So at the country level, you are able to visualize all the labs which are enrolled in your EQA program. You are able to look at the methods that are being used, and you are able to visualize also the performance. And some countries also took that and went all the way to integrating the COVID-19 EQA program alongside the other programs that they have set up nationally, be it for HIV, TB. So they have a wholesome overview of what is happening at country level. So I thank you for your attention, and I'm ending here. Over. Thanks.
Thank you very much, Marguerite. Are there any questions? We don't have any questions in the chat box. We have 2 minutes if anybody has any questions for Dr. Marguerite before we move on to the next presentation, please. Sarah, you have your hand up, please. Could you please go ahead with your question?
Thank you for your presentation. I just wanted to have an understanding on the costs associated with sending out proficiency testing panels for one round of EQA. If there's a ballpark figure that you can provide.
Yeah, thank you. Thanks a lot, Sarah. Actually, it's difficult to answer because it depends on the size of the lab network. Because the more PT you have, the more labs you have, the more PT panels you will need. And so right now, here, I'm not able to provide a number, but maybe One Health Accuracy could be more specific with that, as they were supporting us in that regard. Thank you.
Thank you, Marguerite. So again, please, we'll take questions at the end. Please continue to put your questions in the chat box. I've seen some coming up, and we'll move forward with our next presentation, which is going to be from One World Accuracy. So Dr. Flandon and Mark, please, if you can share your screens and start your presentation. Thank you.
Hello to everybody. My name is Mark Frost from One World Accuracy. We had the opportunity to work under the direction of ASLM to support their SARS-CoV-2 proficiency testing. My colleague, Dr. John Frederick Van Dan, and I will present an overview of the first 2 test events of the SARS-CoV-2 testing, briefly touching on all the areas shown in this outline. One World Accuracy is a provider of over 200 accredited EQA programs internationally, and has a social enterprise commitment to empower local sustainable EQA. Formed 20 years ago in Vancouver, Canada, with an office in Italy and a development team in Lagos coming soon. We had the opportunity to work under the direction and coordination of ASLM to provide the SARS-CoV-2 samples, training, and reporting back to participants performing the COVID EQA testing. We offer a variety of SARS-CoV-2 programs, as seen here, from molecular to antigen to serology, and also including interesting quality controls and validation. ASLM chose the first program, COVID-432, for these test events. ASLM initiated and led this project, directing all the aspects, including selecting the program, assembling a bilingual team, organizing in-country reps, facilitating training, customizing test event timing, and adapting to the situation on the ground as required, providing on-the-ground support, organizing recap sessions, and much, much more. They did a fantastic job that made everything go more smoothly with the ASLM team leading the way. Excuse me. Participation for the first 2 test events went from 7 countries and 125 labs in test event 1, increasing to 12 countries and 204 labs in test event 2. A total of 6 training sessions were offered in combination of English and French, including refresher sessions as needed. ASLM scheduled and coordinated these sessions, including Portuguese translation as appropriate. In alignment with the test event schedule set by ASLM, samples were sent from Vancouver to the in-country reps. The reps then distributed to the labs locally. While shipments arrived to each country according to our expected service level timing, we did experience some unusual customs delays in a handful of situations. We're working to improve coordination with the in-country reps, customs paperwork, etc., to avoid these issues for test event 3 and test event 4. I will now turn this over to my colleague, John Frederick, to discuss the results.
Yes, thank you. So as it was mentioned, so the EQA program that was selected was actually the COVID-19, the molecular EQA testing. And for this program, the samples consist of the complementary DNA of the whole genome of the SARS-CoV-2. So which means that it is actually compatible with any diagnostic kits or platforms or protocols. And for these samples also, so they are actually desiccated into a flux swab, and they are actually inactivated and non-infectious, which give the advantage of being able to be shipped pretty much in any country internationally and shipped at room temperature, and there was no actual shipping restrictions for it. So this is an example of what the participants were receiving. So it's actually the actual flux swab that is found into their own pouch, and they're all labeled individually as sample A and sample B. And the participants, when they receive their swab, basically they just need to reconstitute it according to their laboratories protocols. So when it was time for the submission and registration of the different kits used and the submission of the results, everything was done online into the Oasis website. And this is actually an example of the test event dashboard that each of the participants were able to access. And that's actually on this dashboard where they can get all the different work instruction, the different worksheets that they can download or even print, and that's where actually they will do the registration of their kits and the result submission. And just to show, so the actual dashboard and all the information are available so in English, and it's also available in French. So all the information can be translated into the appropriate language for the participants. So when it comes to the evaluation of the performance of the different participants, so I've just split the results into 2 groups. So the different laboratories that participated into 1 test event, meaning that they tested 2 samples, and some laboratories that actually participated in 2 test events so far. So then they tested 4 different samples. So when we look at the participants that completed 1 test event, we can see that about 80% of the laboratories actually had a perfect score, meaning they answered correctly for both samples. We do notice, however, that 5% of the labs, which means so 6 different laboratories, actually had 1 correct answer and 1 false answer. And interestingly, for most of the case, it was actually participants reporting a false positive sample. And still interesting also is that in most of these cases, it occurred in the test event where the first sample was positive and the second one was expected to be negative. So we can think it might be like a carryover mistake from some of the laboratories. And I just want to point also that 4 different laboratories actually had no correct answer. So we can think it was maybe like a mixing up of the different samples or a clerical error in terms of reporting the results itself. And I just want to point out also that some laboratories actually submitted a problem code, meaning that they were not able to report results during that test event. And different reasons mentioned, it went from the testing being suspended in that lab during the test event period up to, for example, the analyzer being out of service for that time. And so interestingly also, so when we look at the performance of the different laboratories that participated in the 2 test events for the COVID testing, we can see that more than 90% of them actually had the correct answer on all their 4 samples, which was very good. But we can see also a few laboratories that had either 1 or 2 false results during the test events. But importantly, I just want also to point out that the different laboratories that actually had the mistake during the first test event, on the second test event, they actually got good results also. And once again, so few of these laboratories actually reported codes, were not able to do the testing during the test event in itself. So through this project, we did have, I think, a lot of successes and a few challenges. In terms of the success, I think that with this project, we actually had a very good feedback loops between One World Accuracy, ASLM coordinators, as well as the country representative in country. So we were able to address different questions or inquire quite quickly. As Mark mentioned, also we did quite a few different training sessions, both in English and in French, and we were able to provide like standardized and customized different trainings and refresher sessions as needed. Overall, so all the participants actually submitted their results online. And I just want to point out also that we were able to perform the evaluation of the EQA programs quite quickly. So within 2 or 3 days of the test event deadline, we were able to send different participants their performance report. And in terms of the challenge, so as was mentioned also by Mark previously, we did experience a few delays for the custom clearance in some of those countries, but we're actually addressing this issue, which means that we had to extend the test event deadlines a few times just to allow the different participants to actually do their testing and submit their results. And in terms of the next steps, so we still have 2 other test events that are planned for later in 2021. And as you can see, so we will increase the number of countries and participating labs. And importantly also, so for the next test events, we will actually use 5 samples per test event challenge. So we think that it will allow us to really have a better view of the performance of the different laboratories. And we'll also extend into the different trainings and support into Portuguese for some of the country. And finally, so I just want to thank everybody that's participated into this program. So from the ASLM EQA team and to the different EQA representatives in each of these countries. Thank you.
Thank you very much, Jean and Mark. We will move to our next presentation, please, which will be by Dr. Amina Bit-Younis, and this is going to be Cameroon's experience of participating in the EQA program. Kindly continue to put your questions and comments into the chat box for the end of the session. And please, this presentation is going to be in French. So this presentation will be in French. So please, we have French to English translation services. So please click on the channel to access the translation. Thank you. Please, Amina, go ahead.
Okay. So we will present the country experience, the Cameroon country experience in participating in EQA program for molecular diagnostic of SARS-CoV-2. So in our country, we actually have 17 labs that are doing molecular testing for a mean of 7,000 tests by week realized. So in the country, we have many types of platforms. So we have automated platforms. We have also open platforms and point of care platforms that are gene expert. And we have 4 labs that have Abbott and open platform. So the National Public Health Lab was in charge since the beginning of the pandemic. We were in charge of quality management system implementation in the network of laboratories that are doing molecular diagnostic and even that are doing a rapid test diagnostic of COVID-19. So from the beginning, we capacitated the personnel that were doing the test, even that were doing the collection of the samples. So we had practically all the country, practically 500 personnel that were trained in sample collections. We had also supervisions of the lab. These were for the molecular testing labs and mentoring for the labs that were supervised. And we have also organized EQA programs that were of 2 types. We have PT and we have also retesting. For the PT programs, we had 3 partners that we were working with. The first one was with WHO, the ECAP program. We had 2 sessions. The first sessions, just 1 lab was participating. And the second sessions, we had 3 labs that were participating. And after that, from November 2020, we had, with the help of ASLM and Africa CDC, the labs of the countries were registered in the first program with 1 word accuracy. So with this program, we also had 2 sessions. In the first sessions, we had 15 labs. All the 15 labs that were testing at that time participated in this program. And the second session that we did in February, we had 2 labs that were added to the network, to the national network. So we took those 2 labs and we removed 2 old labs to give the opportunity to the new labs to participate also in the program, knowing that we were also registered, so we could not add 2 more PT panels. And at last, we have been registered with the South African program TCEL. We are at our first session. We just shipped the panels to the labs, but we are waiting for the orientation session for the labs to do the analysis. So how did we organize this EQA program in the country? We will talk about the 1 word accuracy program where we were principally involved. So we have been registered, knowing that even the NPHL has a testing lab. So we were registered to 1 word accuracy EQA programs. After that, we had an orientation session organized by ASLM and One World Accuracy. And then yes, and then with all the documents that were sent by One World Accuracy with the panels, we translated them in French, knowing that most of the participating labs in the country were French speaking. So we divided the responsibilities within our section, quality section in the NPHL. So we had personnel that were in charge of the conditioning and distribution of the panels, and we have personnel that is in charge of the monitoring with the participating labs. So for facilitating this monitoring, we created a WhatsApp group. So all the lab contacts were added in the group, and we also requested that more contact from the labs can be added in this group, so that if one personnel is not available, the information can be shared. Following all these participations with the WHO ECAP program, in the first session, the performance was 100/100. So it was very good. For the second session, we are waiting for the results. With the program of One World Accuracy, we had a full performance in the first session. In the second sessions, we have some non-conformity, so we did not make it to full performance. And with the T-cell program, we are waiting for the orientation session, so we don't have much to say. In the national level, at the national level, we have done site supervision of the labs before the PT programs. We have done the site supervisions that help us to do gap analysis, and we are working with the labs to put on corrective actions. We have also another program, retesting, organized by a reference lab that was covering only 4 labs on the 17. Just to say that this was the first program put in place in the country. What have we learned with this participation? Positively, we were very glad that in our section in the NPHL, we worked with the logistics section. So the logistics section is in charge of logistic of reagents and also all materials for the labs. So we used their plan of distribution to distribute our panels, and also for the labs that did not have reagents at that time, they ensured that reagents were shifted from labs that were having enough of these reagents. And we are also glad that we had good monitoring with the labs. There was a good communication through the WhatsApp group. We have some difficulties. I just seen in the chat group that someone was asking if we didn't have a problem with internet connection. It was very recurrent. So there were problems with connections. I remember that we did a second orientation session for the people that could not make it to the first one. So in perspective, we were just talking about molecular diagnostic. We are now seeing how we can put in place EQA or quality assurance in rapid test sites. We are thinking of doing site supervisions. So this is all what I wanted to talk to you about. We will not end before thanking Africa CDC, ASLM, WHO, and UNITAID for the help that they brought to us for organizing these programs. Thank you.
Thank you very much, Dr. Amina, and also thank you for the flexibility in presenting in English. It was very clear. I think we all understood. So thank you very much for that, Amina. So we are at the end of the presentations. We're going to move ahead to look at some of the questions that we had from participants in the chat box for the next 15 minutes of the session. And we can start with the first one that I think will go to either Dr. Massinga or to One World Accuracy. And the question is coming from Milimo. Milimo asks, generally, what indicators were you using tracking in your program? So what indicators were you tracking generally? So either Mark, John Frederick, or Marguerite.
Thank you, Beatrice. Maybe I will let One Health Accuracy respond first, and then because we have a different perspective, and then I might complete. So
Okay.
they can provide information specifically for the Q&A.
Mm-hmm. So Dr. Flandin?
So from our sides, in terms of the different following up we were doing, so first of all, during the different logistic parts, so during the shipments, actually all the different shipments were actually tracked by the courier company, and really rely, talking with the different consignee and with ASLM when needed, trying to facilitate the custom clearance. And in terms of the actual results submission rate, we actually had almost a daily following up with the ASLM, so really trying to monitor the different laboratories, their different status, if the results were actually submitted, and if there was any question. So it was actually quite a good feedback loop on this time. So from our side, when we were seeing missing results, basically it was actually shared with the ASLM overall coordinator, Blessing, and then it was passed on to the different EQA country representatives. So they were actually doing the different follow-up with the lab, so calling them, reminding them how to submit their results, actually.
Okay, thank you, Dr. Flandin. So Marguerite, would you like to add on to that, please?
Yes, thank you, Beatrice. So yeah, as I indicated, we had a follow-up monitoring component, and this was represented by the EQA dashboard that was set up, and it was standardized across the countries, and the indicators that were followed which are being followed in that dashboard include the coverage. So we can see which labs in the lab network are participating, and we have their geographical location. We are also monitoring the type of platforms that are being used, because there are quite many PCR platforms that are being used, and we also do include gene expert labs. And so this is being followed, and we are looking at the performance also for the different labs. And just also to highlight that as far as the support project we're concerned, EQA is one component of a more general support, which was also targeting different aspects of LQMS, so Laboratory Quality Management System, throughout the lab.
Okay, thank you, Marguerite. So the next question is for Mark, please. And Sherry asks, does One World Accuracy PT program address the variants of concern as well? So that question was directly to Mark.
For the current panel, maybe JF, you could pipe in here.
Yeah, so currently we don't address the different variants. So it's really the typical SARS-CoV-2 that was previously identified, but we're actually working with our different samples providers. So hopefully we will be able to address these in the future. But once again, since currently no, but it's something we would like to add into for the next test event, or later during the year, actually.
Thank you, Dr. Flandin. We have a question from Bernard to Amina, please. Bernard asks, how did you select the 4 labs on the retesting strategy, and what informed your decision?
Okay, thanks for the question. The 4 labs were parts of the National Influenza Network Surveillance Network. So that network was coordinated by the Centre Pasteur du Cameroun. So within this network, they are the one that prepared external quality control and sent to the labs, and then they did retesting. There were no criteria for choosing them. Thanks
very much, Amina. There is one question here from Valerie, which also relates to a previous question, which was asked about EQA programs for antigen test. Are there any current programs for antigen testing in any countries across Africa? So perhaps maybe we can start with One World Accuracy, and then we will move to the Dr. Marguerite to answer that question. So Valerie asks, and also there was a question from Ugozi about EQA programs for antigen tests, please.
Yes, so from One World Accuracy, we do also have the antigen testing EQA programs that could be ready to be sent also to any different countries. And it's really for testing the nucleocapsid antigens of the SARS-CoV-2. And just generally, it's the same then for the molecular. So they're actually shipped at room temperature, so it's quite easy to get them around. But yes, we do have this EQA program available from our side, actually.
And further to that question, John, Valerie would like to know, do you have any set criteria for selecting the participating facilities? Because for those facilities doing PCR, we know that it's quite a closed network, but for those doing antigens, it may be spread across. So is there a specific criteria for selecting those who are doing antigen testing?
For actually selecting the actual testing sites, we actually rely on the information provided by the Ministry of Health or by ASLM. So actually they are the one that select their testing, the different testing sites actually. So, so any sites in a country that actually does this testing, it's not a challenge necessarily from our side, actually.
Thank you. There is a question here from Ramatu who says, please, who paid for the participation in the EQA program? So who funded the EQA program? I think that was answered by Dr. Massinga in the chat box. We had funding from Resolve to Save Life. So that is the funding that went towards towards supporting this EQA program. There's one more question from Oscar who asks, were there any major findings relating to equipment? So from the results that you had from the labs, were you able to identify any maybe cross-cutting issues with equipment across the labs that were doing the testing? Dr. Marguerite, would you like to take that question?
Yes, well, I mean, what we realize with the EQA program is that you can only go as far as the system is efficient. And indeed, if you have issues with the equipment, or if you have issues with the supply chain, etc., this will have an impact on your ability to take part, to submit the result on time, or to display a good performance. Yeah, but I think maybe Dr. Amina, with the country perspective, could provide a more practical answer to that question.
Dr. Amina, would you like to add on to that, please? From your Cameroon experience, did you have issues? You already mentioned that there were issues with internet connectivity. Were there any issues regarding equipment or maybe reagents even to do the testing? There was a question related to that as well.
Okay, regarding the country experience, with the equipment, knowing that we have many types of equipment in the country, it was mainly in submitting the results in the OASIS platform that we had to work with the labs to see how the results can be submitted, especially with GeneXpert. But at the end, all went good. Another challenges we had with the T-cell program, the panels were refrigerated samples. So we took a time for sending them to the labs because we had to ensure with the transportations agencies and with the labs all the conditions all the conditions required for the conservations of the PT panels. Over.
Thank you, Amina. A follow-up question, please, to Dr. Flandin. Bernard asks, the CT values for GeneXpert equipment would register a positive even at values of CT40. Did you consider this in the preparation of the PT panel for these platforms?
Yeah, so in terms of the CT value, so this was generally information that we collected, and we asked the different participants to provide that information. But in terms of the evaluation itself, actually it was, we evaluated what was their serology status. So which results at the end of the day, they would send to their doctor as a positive or a negative sample. And in terms of the different, so really what was important, it was really to the lab to decide would they call this sample a positive or a negative one. Mm-hmm. And in terms of the, so really it will depends on their own algorithm in the lab, what they would call a positive or negative. So it was up to the different laboratories.
Mm-hmm. And just to follow up, Dr. Flandin, there's a question here from Edmond who says, do your PT samples work for rapid PCR test methods like Vivalytic?
So I'm not aware of this method. So I can quickly look. So my first answer is probably yes, but I'll just have to double check on this one actually.
Mm-hmm.
Let you know.
Okay.
So.
Right, thank you very much. Dr. Marguerite, I'll give the floor back to you. You wanted to address the questions on the RTD EQA. Please go ahead.
Yeah, thanks a lot, Beatrice. So about the RTD EQA, as I mentioned at the beginning in my presentation, you have different options for EQA. So of course, PT panel is one of them, but you also have the option of supportive supervision and also retesting. So these are also alternatives that country might consider and that can be implemented. And we have designed a checklist that can be used. So it's a standardized checklist that can be used by the country teams as they go to do the supervision of the program. It's based on the HIV SPI checklist, and it has been adapted for COVID-19 as well. So this is what I wanted to mention. Mm-hmm. And maybe just quickly, because I see that question coming back about registration. So there are two options. So for COVID-19 labs that are currently being registered through the program, through the support that we have been providing, they have been selected by the COVID-19 lab pillar of the COVID-19 response or the National Public Health Lab. So it's really to coordinate with that or the lab directorate. So whichever entity is really coordinating the lab network at the national level is the entry point. And then if you have your own funding, that's a different issue whereby you can contact the PT provider directly. So just to provide that clarity. Over, thank you.
Thank you, Marguerite. So Edmund just clarified here that Vivalytic is by Bosch and it comes out of Germany. There was a question here about registration, which has been addressed by Dr. Marguerite. And I think that we've been able to address most of the questions that were in the chat box. We have 2 more minutes left. And so if there's any last questions, anybody who would like to add any last questions, please raise your hand. Otherwise, we will move to end the session. Please also, information was put in the chat box about how to register as an ASLM member. And there's also more information on the screen now. Please make sure that Anafi put the information in the chat box, so you can go to the ASLM website and do that. We've also given you the link to access previous recordings to this session and to previous ECHO sessions. And you can also download your certificate, which is being shown on the screen. Right. Any final questions, please? Okay, so Joshua says we need the PowerPoint presentations, please. Okay, so we'll discuss with Anafi and see whether we can make those available to you. Otherwise, would like to say thank you everybody for participating in this afternoon's session. Please look on the ASLM website for upcoming sessions, and we look forward to our upcoming sessions in the future. Thank you very much for your participation this afternoon.